I'm excited to talk about my presentation and participation at the SCLC TTLC 2024 and its 50th anniversary. We had a great session on small cell lung cancer. And specifically, I was tasked to discuss immunotherapy combinations in small cell lung cancer. So that's no easy feat. We know that chemotherapy plus immunotherapy is the standard of care for patients with extensive stage small cell lung cancer in the frontline setting. However, most patients experience disease progression, and we need new therapies that lead to better outcomes in patients with extensive stage small cell lung cancer. And I think also importantly, we need to identify not only patients that have these transformative responses to immunotherapy combinations, but also we need to identify patients who will not, and then who might be appropriately better served or better directed to other therapeutic options. And this is an area of unmet need. So I started out by talking about some strategies for modulating anti-tumor immunity and the importance of, changing this immune desert tumor microenvironment that small cell is, given low MHC complex expression and relatively lower PD-L1 expression on tumor cells compared to non-small cell lung cancer. So beyond looking at these biomarkers, one thing that has been found to retrospectively be potentially important for immunotherapy in patients with small cell lung cancer is strategies to enhance antigen presentation in small cell lung cancer through identification and targeting of critical epigenetic regulators. I talked about several other strategies, including strategies to increase neoantigen load through PARP inhibitors and, for example, ATR inhibitors, highlighting some of the progress we've made with using SLFN11 and SWOG 1929 as a predictive biomarker, demonstrating in that study that the combination of Atezolizumab plus Talazoparib led to improved progression-free survival to a modest degree. However, no significant improvement in overall survival. I think highlighting, number one, that we can use predictive biomarkers in small cell lung cancer in prospective trials, but also that we still need to better identify the population who will benefit the most from PARP inhibitors in combination with immunotherapy. I also highlighted other strategies now in the front line, including strategies using anti-VEGF as a way to create a more immunoactive tumor microenvironment. We know that VEGF is immunosuppressive in the tumor microenvironment. And I highlighted two studies, one including the randomized Phase III trial called ETER701, investigating a novel PD-L1 inhibitor from China in combination with Anlotinib, a VEGF TKI plus chemotherapy in frontline. And that study showed improved progression-free survival and improved overall survival. And this was the best overall survival that we've seen in a randomized Phase III setting in the frontline, with a median overall survival here of 19 months. I also highlighted the other trial that came out of Italy, a single center Phase II trial called the Celebrate study, that in the front line combined carboplatin etoposide with Bevacizumab, a VEGF inhibitor, and Atezolizumab, also meeting the primary endpoint of overall survival there, with a 1-year overall survival rate of 61.8% and a median overall survival of 12.7 months. However, that gain was associated with higher rates of toxicity and 4 grade 5 events, 2 due to sepsis from neutropenic fever, bleeding, and pancreatitis. I also highlighted the use of BMS 986012. This is an antifucosyl IgG1 monoclonal antibody in combination with chemotherapy and nivolumab in the frontline setting. This is a randomized Phase II study that is ongoing with the primary endpoints of safety and tolerability and progression-free survival. Other strategies in small cell lung cancer include the addition of Atezolizumab to lurbinectedin in the maintenance setting, the INFORTE study. And then lastly, combining immunotherapy with radiation and the gains that hopefully we'll see in patients with limited stage small cell lung cancer. We also talked about some early strategies that are still in development with use of epigenetic regulators, LSD1 inhibitors in combination with nivolumab in patients with immunotherapy sensitive disease, looked promising, including the biomarker studies that showed the ability to create a more inflamed tumor microenvironment. And there are ongoing efforts, including a study in the ETCTN. They'll be investigating an LSD1 inhibitor in combination with Atezolizumab maintenance in patients after induction chemoimmunotherapy. So in conclusion, despite the recent advancements in first-line chemoimmunotherapy, we definitely need additional strategies that provide a greater magnitude of benefit, especially in the front line as well as in the maintenance setting. Multiple efforts are underway investigating these combinations to modulate anti-tumor immunity.